the Moxetumomab Pasudotox data that I talked about today was combining the phase 1 and 3 data and looking at minimal residual disease. And what we find is that that if you can get rid of minimal residual disease, you can have a longer complete remission duration. We looked at the different tests of minimal residual disease, including immunohistochemistry, bone marrow aspirate flow cytometry, and bone marrow biopsy, and bone marrow and blood flow cytometry. And we find that the most sensitive is the bone marrow aspirate flow cytometry. And that test can discriminate very well the patients who have a long complete remission duration and patients that have a shorter complete remission duration. In other words, if you don't achieve MRD negativity, you have a shorter you have a shorter complete remission duration. However, bone marrow biopsy is difficult to do very often when you're treating hairy cell patients. We do it several times, but it would be nice to be able to determine with each cycle of Moxie that you give what the MRD status is. And so the problem with blood flow cytometry is it's not quite as sensitive, and in fact, of the 41 complete remissions that we assessed blood flow cytometry of the patients that we treated with Moxie on the phase 1 and 3 trials, only one of those 41 patients was blood flow positive. All the other patients were blood flow negative, so it doesn't really discriminate patients who would have a longer or shorter complete remission duration.